So 1, 2. 1, 2. Goeiemôre. Weer eens. Dames en heren, as ons net ons sitplekke kan inneem asseblief. Ons wil voortgaan met die program. One, two. Daar's hy. Goeiemôre, welkom terug. As ons net ons sitplekke kan inneem asseblief. Ons wil graag voortgaan met die program. As ons sitplekke kan inneem asseblief. Ladies and gentlemen, if you could please take your seats, we'd like to continue with the program. Thank you. Nou, ons het al reeds vroeër vanoggend die verrigtinge hier geopen met 'n gebed. Baie dankie aan Brenda Klaasen wat dit vir ons gedoen het. Sy is ook 'n cancer survivor of 'n kankeroorlewer en deel van die journey of hope hierso. Nou volgende gaan ons aan ons eerste burger hier in Oudtshoorn, dit is nou raadslid Johan Allers vra, net om namens homself en die municipaliteit en dan ook die dorp Oudtshoorn vir u amptelik hier te verwelkom. Kom ons verwelkom nou by die podium raadslid Johan Allers, die burgemeester van Oudtshoorn.
Dankie. Ek het nog nooit so baie gepraat op 'n dag as nou nie. Maar Oudtshoorn. Sorry, ek het net 'n boodskap gekry van Engels ook tussenin. Nou gaan dit stadig gaan. Good morning to everyone and welcome. It's a great honor for me to be here with you. It's a great honor that my office could manage this day in the way it is now. Ek was baie surprised toe ek hier inloop en ek sien al die stalletjies en die belangstelling van buite oor die projek en oor die siekte kanker. Ek het al, soos ek voorheen gesê het, dit gaan net dupliserend klink, maar die een is 'n lewendige uitsending wat nou nog nie lewendig is nie, maar gaan nog lewendig kom. So jammer vir dit, dat dit nou dupliserend klink. Maar ek kan nie begin sonder om te sê, oom Jaapie, dankie dat jy eendag by my by die kantoor was. Toe ek nog speaker was, het die ouma aangekom en vir my gevra, kan die raadslede net 'n bietjie 'n bydrae maak vir die kankerhuis in George nie. Nou, dit klink al klaar snaaks om te sê 'n kankerhuis in George. Ja, Oudtshoorn mense moet die kankerhuis in George ondersteun, want George se mense gaan bly mos nou nie in die kankerhuis in George nie. Ek bedoel, hulle gaan ons na hulle huise toe, die George mense. So die kankerhuis in George is juis vir mense wat buitekant George bly. So dit is hoekom ons die projek ondersteun het. En daarna het hy weer na my toe gekom en hierdie Journey of Hope het ons 'n vergadering geroep. En nou sit ons vandag met hierdie wonderlike produk. Ek wil nou nie, dit klink miskien nou snaaks 'n wonderlike produk, maar dit is 'n produk van mense wat by mekaar gekom het en besluit het, let's do something in Oudtshoorn. And I'm very proud to see what they achieved. Ek sê weer eens, dit is maklik om te sê die burgemeester. Die burgemeester se bydrae is baie gering. Die bydrae kom van hom Jaapie, sy komitee wat hy het, en die twee dames in my kantoor, Demorian en Netta. Dit is die mense wat hierdie ding gemaak het wat dit is. Hier is so baie fasette van waaroor 'n mens kan praat vandag. Maar die een ding is dat as jy praat van kanker, is dit nie baie ver van jou af nie. Op een of ander manier is dit eintlik maar baie naby in elke huis. Ek het verlede jaar het ek 'n baie groot vriend van my verloor aan kanker. Hy was ook 'n survivor, dan kom die kanker terug. So dit is moeilike dinge om oor te praat baie keer, maar dis iets wat ek geleer het toe ek nou in die kankergemeenskap begin inkom waar dit wel is dat almal hierdie positiewe uitkyk op die lewe het. En dit is vir my wonderlik en amper half onverstaanbaar. Hoe kan jy met so siekte al hierdie wonderlike positiewe dinge elke dag, dag na dag, vertel die mense vir jou van ek is 'n oorwinnaar en so aan. Ons wil môre deur die dorp ry oor survivors. So I think if you're so lucky or privileged that there's no cancer in your family or that, well, then you're lucky. But I think to find that family that is also will be a miracle, because it's all over. Weer eens, baie dankie vir ieder en elk wat deel is van hierdie program, wat hierna toe gekom het as mense van die publiek. Hierdie is 'n program wat ons uitgereik het vir almal. Ek sê baie dankie vir al ons borge wat hier is vandag. Die mense doen dit gratis. Demorian Engels. Yes, thank you very much for all the sponsors. Each and every one of you are in your own unique. You know, there's even a Daga store here, but they don't call it Daga anymore. It's boom. Nie boom. That's even worse. So nie as cannabis. Hulle het nou 'n ander naam vir dit. Nee, dis ek gaan nou daar agter vra, maar ek het net die woord gehoor, ek dink vir die eerste keer in my lewe. Maar so thank you. I mean it's a very unique day and we really appreciate each and every one. Again, thank you and make use of all the stalls that's here. They can assist you with from a will to whatever. There's the Pathcare, for instance, they are handing out vouchers that you can go and draw your blood at the clinic, at the laboratory, at Mediclinic. Yeah. Okay, so thank you very much, and I hope you have you enjoy the day further. Thank you.
Dames en heren, ik moet ook zeker in Engels praten. Nee. Ladies and gentlemen, the Mayor of Oudtshoorn, Alderman Johan Allers. Now, don't go too far away, sir, because there is a presentation that's going to be done now to the Mayor of Oudtshoorn. So we're going to be calling on IMATU, which is the Independent Municipal Allied Trade Union. They're going to be doing a presentation, and we're going to be calling on Mr. Wimpy de Jaar to come and do it to the Mayor on behalf of IMATU. Put your hands together for Mr. Wimpy de Jaar.
Goeiemôre almal of middag. My naam is Wimpy de Jaar, voorsitter van die IMATU Trade Union. Ons oorhandig net 'n kers oor aan die Meyer, dis sy projek die vir amptenare wat oorlede is van kanker. Daar is baie van ons mense wat hier werk wat op die huidige oomblik gediagnoseer is met kanker. En dan vir die survivors, ons het 'n hele paar survivors ook hier in die munisipaliteit. So dit is ons gedeelte wat ons bydra aan sy projek en vir die gemeenskap. Baie dankie.
Baie dankie aan IMATU vir die oorhandiging. Nou, ons gaan sommer voort met die program soos dit is. En volgende gaan ons vir Dr. C. Dreyer vra om na vore te kom. And Dr. Dreyer is involved with the cancer roadmap. He's going to be talking about the cancer roadmap. Dr. Dreyer.
Good morning, everybody. Can you all hear me? Yeah. Now, a couple of weeks ago, I was asked to say something about cancer. And my experience with cancer is that it is, like many of the other diseases, still very neglected in most of our minds. Yesterday, I had an interaction with one of the patients that was diagnosed with cancer, and this particular patient didn't want the son to sit in while I was talking to her, and I had to explain to her she can't walk the journey alone. She needs to have somebody with her that understands and that will be able to help her to continue and help her along with her journey. So the cancer roadmap is a map that covers all the difficult topics that you need to discuss. It shows the paths that the diagnosis, after it was made, that the diagnosis will take through treatment and after the treatment was stopped. Now these maps allow a patient and their loved ones with the clinicians to identify where the patient is in the cancer experience or in the cancer journey, and where they want to go, and the potential paths that they have to take to get to where they want to go. The cancer roadmap also shows what might happen to a person, and it might help the person to better prepare for what is lying ahead. The map will lead to a decision-making process for the person, and there will be points in the map where you have to decide what decision are you going to make and what path are you going to take. And all of these decisions is put out in a way to help you move forward. The cancer roadmap improves the understanding of a lot of complex information. And what I found is when a person is diagnosed with cancer, the diagnosis is made, and from that moment on, most of the doctors and the sisters stop speaking to the patient. And the patient has got a lot of issues and emotions that needs to work, that he or she needs to work through, but that doesn't happen. Because after the diagnosis was made, the next step would be that you're going to go home, and then you have to look after yourself further. If the department can't help you further with treatment. So the best treatment plan for you will be based on evidence-based medicine, and it will be based on what is your values and what is your goals that you want to achieve. Now the person and the caregivers and the oncologists, all of them usually are very overwhelmed with the complexity and the difficulty to communicate all these difficult informations and topics that needs to be asked. Thinking about what's going on and what one wants and then making a decision is very challenging, but it is an essential process that you need to go through. The roadmap also clearly identifies certain decision points, and by using a map, you can anticipate when a decision is necessary, appreciate the different options, and associate the benefits and the harms that might come to you. If you can think, if a person gets diagnosed, it's always asked what is the best treatment. There's also a question, if in the public service you can't be helped, the next question is, will I be able to be helped in the private sector? Now, if people are not honest with each other, a lot of money could be spent unnecessarily in the help of this particular patient. Part of a person's preparations include thinking about your own values and goals and how you're going to be affected by what is happening to you, and also what you think about the potential benefits if you are being treated for the cancer that you have. You must weigh up the harms that might come to you through either an operation, through chemotherapy, or through radiotherapy. And the roadmap helps you to organize your thinking in a bit, talking to people and understanding what is the best way for you to move forward with your disease. So there's also a lot of planning and coordinating of your care that needs to happen. Once you have made your choice, this is the treatment that you're going to go forth with the doctor. The roadmap helps you to implement your treatment in a care plan that would be safe and efficient for you. The map provides, in a way, a visual summary where you are at a specific point in time, and where you are moving towards. It helps you understand what is going to happen next. And it minimizes the misunderstandings if there's a miscommunication between you and the doctor or between you and the sister. So how does this journey look? It was mentioned earlier by the burgemeester that he's happy in the space that he can say from his side that he himself doesn't have cancer. Now, cancer doesn't ask who is going to affect. It affects everybody. It doesn't matter if you are rich or if you're poor. It doesn't matter if you are white, black, or yellow. You're going to get cancer. And sometimes it's because it's in the genes. And sometimes there might be nobody in your family that have cancer, but you are going to be the one that's going to be diagnosed with it. So every journey starts somewhere. So the cancer journey starts where you don't have cancer. And then one day, you present with some symptoms and you become worried about the symptoms. So that little bit before that symptom start is the life before cancer. And then the next part of the journey will be you're developing symptoms and you're going to be examined, and the examination might lead to the thought that, this might be cancer. And cancer is not always up front in everybody's minds and thoughts. That is now the clinicians. But usually when a patient goes to a doctor and he's got a complaint, one of the worries that the patient have is, isn't this cancer? And if you didn't make sure that you understand that that is one of the worries of the patient, then you wouldn't be in a space to identify the real need that the patient have in trying to relay the patient's fears. So after the symptoms, a diagnosis will be made, and then a whole new range of issues comes to the forefront. Do you have a medical aid, or are you reliant on the public service? What is the different kinds of treatments that is applicable to your type of cancer? Because sometimes a person might be operated and being sent home, and then the family will wonder, and the patient, but why didn't they give me chemotherapy? Why didn't they give me radiotherapy? They didn't treat me fully. And that is all the different questions that needs to be asked during the treatment cycle. When you are diagnosed with cancer, the diagnosis alone has a big influence on your family. Some of the family members will become scared. They will shy away from you. Other family members will want to know the detail, and you might not be in a space where you want to tell them the detail because you yourself still want to hide it and keep it for yourself, which is not a good space to be in. The diagnosis might affect your sex life. If you are a male or you are a woman, and you get diagnosed with either prostate cancer or cervical cancer, all of those has an influence on your sex life. And if you don't talk about it, you won't know what and how to proceed forward. It might have an effect on your work, on your career. It might suddenly halt yourself. You get halted in your work career. So if your employer doesn't understand that you've now been diagnosed with a dread disease, and you are not honest with the employer, you might carry on working while it's actually your last couple of months that you are in the workplace. It might, if you're a student, it might affect your studies. So the diagnosis of cancer really have a big effect on the normal day-to-day life of a person. And then if the diagnosis was made and the appropriate treatment was applied to you as a person, there's the post-treatment part. Now in cancer, and that was also alluded to a little bit earlier, in cancer it is great if you get surgery, if you get chemotherapy, if you get radiotherapy, and you are one of the lucky ones that are considered to be cured. We say that you have won cancer. Now as I'm standing here, I was diagnosed with cancer almost 4 years ago, and I had an operation, and the hope was that operation is also a curative one. But I can promise you, even although you had that operation, cancer doesn't leave your mind at all. It stays with you every day. With every person that you deal with, it comes back and it haunts you. So you have sleepless nights. So So even although you consider cured, you will still be in chronic care because there will be regular follow-ups, blood tests that needs to be done, regular follow-ups to see, are you going to relapse? And remember now, if you relapse, the second time the cancer comes around, it's usually worse than the first time. So the first time is the best time to be cured. Then if you're one of the very, very fortunate ones, which I believe with all my heart that I'm one of those, you go into long-term remission. And it is those people that have the best positive attitude towards life. And even if cancer then go into a relapse phase, that person will still be positive about it because he embraced the cancer for the disease that it is and not something fearful that might end his life. Wherever you find yourself on this road of survivorship, ensure that you are surrounded with adequate and enough caring people. Not people that's curious about you. Surround yourself with caring people. People that will be able to assist and help you to walk this road. They will help carry you through the dark and the lonely days because they will come. You will feel some days that you are not in a good space and you need people to assist and support you through that time. So I call these people the angels that will help keep the darkness at bay. Thank you very much.
Thank you very much, Dr. Dreyer, for those inspiring words. Volgende gaan ons vir iemand van Cancer 'n geleentheid gee from Cancer. Please welcome Ms. Sharon Venter.
Good morning, everyone. I'm Sharon Venter. I'm from the Cancer Association of South Africa. As everybody knows, cancer. Our offices is based in George. We had one here in Oudtshoorn. Unfortunately, that office closed, but we're still running from George, the main office. In Oudtshoorn, we do have carers who will support patients when they've been diagnosed, like Dr. Dreyer says, to support the family through with the road that they're facing. If you do not want to talk to a carer, you can go on the website. You can connect to Cancer. You just put in CANSA, and then you connect to connect with Hope, where you can get counsellors who can in your privacy of your house. You can talk to them, explain to them your problem, or if you just want to. If you are a carer or a guardian or somebody looking after someone with cancer, you can phone them and talk to them if you don't want to talk to somebody in the town. The town is very small. We do sell wigs, as everybody know. We support patients with stoma. Stoma is where they have a bag due to colorectal cancer or bladder cancer. We also provide patients with nappies and Nutrimil that we sell at the office in in George. We also have a clinic once a week where we do cancer screening, like clinical breast examinations, pap smears or PSA testings. Unfortunately, those testings are not for free, so there is a amount that you have to pay for that. Then we also have the Irma Bruschke care home. Somebody else earlier spoke about the care home. That is when patients have to go for their radiation in George, and the road is a distance to drive. Then you can apply and stay over at the Irma Bruschke care home, where we will then take you to your treating venue, and we will take you back to the care home, and you have 3 meals and you can sleep there for the week. From Monday to Friday, and then weekends the patients goes home. And that is our cancer. We are still here. Please, guys, don't hesitate to ask us. You can even, at the Bridgeland Clinic, you can ask Ashida, anybody, if you have questions, just ask and she will put you in contact with me. All right.
Thank you very much. Sharon Venter from Cancer. Voor ons voortgaan met die speeches hierso, of die toesprake, gaan ons net eers vir mevrou De Morien Apollos vra om na vore te kom. So, daar is vroeër was daar 'n raffle of 'n loetjie wat hulle geloop het. So ons gaan nou daai pryse oorhandig. Jessie, ek wens ek het een van daai loetjies gevat van. Maar wat is in daai bokse? O, dis die mense wie die meeste loetjies verkoop. As dit die pryse is vir hulle, wonder ek hoe lyk die loetjie. Wat wen die mense vir die loetjie?
Pryse is
Klaar uitgegee. Okay, so ek is bietjie laat, sorry, ek is laat. Sekere dinge is dit goed om voor laat te wees. Dis een van hulle. So voor ons voortgaan met die toesprake, De Morien Apollos, asseblief. Well, terloops, die burgemeester het vroeger, Meyer mentioned earlier that he does the least of the work. There are other people who do a lot of the work. She's one of those people who put all of this together. So this is De Morien Apollos.
Good morning, everybody. Journey of Hope had a raffle where we had quite a lot of support, but our members, our committee members, were the ones who had to sell all the tickets. And I really want to acknowledge the hard work of two of our members, the two members that sold the most tickets for the entire raffle. The one goes to Mrs. Shafai Wickham, and the other one goes to Sister Margie Duplessis. Can you please come to the front? I would just like, on behalf of Journey of Hope, I would like to thank you for your hard work. And we got this sponsored to nice thermal jugs worth 750 Rand each.
Thank you very much, De Morien. She'll be back here later on to do the vote of thanks for us. For now, though, cancer, when we think of cancer, invariably we think of people our age and older people. But often children are affected, not affected, but they actually are diagnosed with cancer. And that's why we have an organization like CHOC, who really focuses and zooms in on working with children living with cancer. So please put your hands together as we welcome Ms. Ruby Matura from CHOC to come and talk to us about what they are doing.
Good afternoon, everyone. It's such a large crowd, and I'm so happy to see so many people have attended. As you've known, I'm Sister Ruby Matura from CHOC, and CHOC is the Childhood Cancer Foundation. This foundation has an aim. Thank you. This foundation has the aim of increasing the number of patients or children who have cancer, the survival rate of cancer, as well as to detect and to treat early childhood cancer, because cancer in children is curable. Now, people think that if you have cancer, then it's a death sentence. But children who have cancer, cancer in children forms in organs. It does not form like in the adults in the skin tissues and inside the lining of the body. And because it is in the organ, it is localized, it is much easier to treat, and of course, then the patient's survival rate will increase. The important thing about treating these children is to ensure that one knows the signs and symptoms of early childhood warning signs of cancer. In children, there are certain signs and symptoms that indicate that the children possibly have cancer and need to be investigated, because these signs and symptoms are similar to other conditions as well. So the first thing I want to talk about is the signs and symptoms, so that people will understand what's it all about. Then thereafter we'll tell you what CHOC actually does. Childhood cancer has a slogan which is known as St. Silouan slogan. There are pamphlets there with those with the signs and symptoms of cancer. There are little pamphlets that look like this. Okay, these are the pamphlets. They tell you all about the signs and symptoms of cancer. On the back of the pamphlet is all the contact details for all the centers in South Africa. What we must remember is that cancer in children must be treated by a specialist oncology who is pediatric oncology specialist, and they must be treated in a specialist oncology units in order for them to be treated effectively and for them to survive. There are 2 such centers. The one is at Tygerberg Hospital, the ward G3, and the other center is Red Cross Hospital in the Western Cape that I'm talking about, and that is in ward G1. These children must be referred, if they have been diagnosed, they must be referred to these 2 centers for actual treatment, and their chances of survival will be very, very good. But if you delay the diagnosis of cancer, then the children's survival rate decreases. And also, even if they have cancer and in the later stages, they can still be referred, because then they can have comfort and treatment according to their needs to have the last few days in comfort. So that is very important. So if you take these pamphlets, you will find all the details and take a picture of both sides, and you will have it with you all the time. So wherever you go, it will be there. This signs and symptoms. Unfortunately, there aren't facilities here for to show it to you on the screen, but they are. It's Siluan. That is Silouan. It's Saint Silouan, who was a humanitarian. He was a Russian humanitarian, lived in the 1860s, and he did a lot of humanitarian work. And this slogan is a tribute to him. So the S stands for seek. If your child is not getting better, then you will seek attention, seek medical referrals, so that these referrals will then diagnose whether the child has cancer or not. It is important to know that childhood cancer starts any time from the time of birth right until whenever. So if it is not being identified as cancer, you can be treating the wrong diagnosis. Okay? So that is why we talk about signs and symptoms. If you go to the clinics or wherever and they are treating the child and the child is not getting better, with the second episode if the child is not getting better, for an example, if the child is very tired and the child continues to get tired, but it's less tired because they're giving iron preparations, they are treating the wrong diagnosis because the disease is still progressing. So that one must remember is important. As well as if the child has infections, these infections come repeatedly. So you have infection, you get the antibiotic.
Sorry, can you just move closer to the microphone because I can't hear you?
Oh, I'm terribly sorry. Okay, sorry if you didn't hear that. These signs and symptoms for infection, they are repeated, but they're getting treated for infection, but it could be a possible cancer, it could be leukemia, it could be something different. So therefore we say there are repeated signs and symptoms or persistent signs and symptoms, one will have to refer the child for specialist investigations, if that is very important. So that's the first one, S. Then the I is for eyes. Cancer starts in the eyes as well. If the child wasn't blind or the child didn't have a squint, but suddenly the child is squinting and the child is becoming blind. Now that is a cause for concern. Not only taking the child to the optometrist and getting spectacles, you need to investigate why this is happening, because a new squint and a new blindness may be an indication of cancer. If the child's eye is bulging, it means it comes out of the socket and it's swollen. There must be a reason, and these are the signs for eye cancers in children. And they are very common, and they're known as retinoblastomas. And then the other thing is, when the child has spots in their eyes, you may see the spot that it may be visible, there may be red or there may be white spots, and these spots must be investigated. You take the child to the clinic, they look into the eye and they see if the back of the eye has a spot. If it is red, for an example, in the front and red at the back of the eye, then it's fine. It means the light is reflecting onto the eye. There is no problem. But should the spot be black or white at the back, it means something is blocking that light from entering the retina, which now converts it into signals to send to the brain, and that could be cancer, or it could be just an abnormal patch or tumor in the behind the eye. That is what we need to investigate so that the child can be treated. Okay, so that's very, very important. So we've talked about new blindness, spots in the eye, and bulging of the eye, and new squints. The next one is lumps. Most people have heard of lumps, or L is for lumps. There are two types of lumps that occur in the human body. One is hard, and this lump is fast growing. It is hard, it does not move, and this lump is usually not painful. So if the lump is not painful, we don't look for help until it becomes painful when it starts to press on the nerves. So therefore every lump must be investigated. The other lump is a soft lump. It doesn't grow as fast, gets bigger, gets smaller. This lump is usually not a cancerous lump. But CHOC has made it a mandate that every lump in a child must be investigated, because we cannot say by just looking at the lump. They do a biopsy, they do blood samples, and that is when they will tell you if the child has cancer or does not have cancer. So by just looking at these things, we cannot say. So if you go to the doctors and you go to the clinic and they are not assisting you, please insist on getting a referral to a specialist or to the hospital to get investigations. Because nobody can treat you without an investigation when the child repeatedly has the problem which is not going away. Okay? And lumps, where are they found? They are found inside the head, any part of the body, outside, inside, under the arm, in the groin area, in the testes, in the stomach. So if the child has got an enlarging stomach and they tell you the child has got worms in the clinic, this you must, if the child has taken the worm medication and it is not reducing, they need to examine that abdomen, they need to send to check if perhaps there's a cancerous lump in there that is growing. This has happened, and children have been treated for worms and they have died because the cancer was detected too late. Okay, so that is very important about the lumps. It can be anywhere in the joints, in the spine. Really, you can't see it, sometimes you can. Then the next one is unexplained. The U is for unexplained. When something happens to your child and you can't find the reason, you keep taking the child to the doctor, the child's fevers are coming and going, as the antibiotics wears off, and then the next time it happens again, you know that there is a problem. Especially if the child is having these repeated infections, as well as the child is looking pale, the child is tired, the child doesn't want to eat, the child loses weight. These are signs and symptoms also of anemia. But we must do the investigation to say this is definitely anemia. And then we must find out why the child has anemia. If it is not anemia, then it's possibly cancer. Because when you take the child to the road to health clinics to check their charts there, they must see that the weight is going down, the child is pale, the child is tired, not concentrating in school, and we call them lazy because they have been doing these things, but now suddenly they can't. But it means that the condition is progressing. So it is so very important. The other important sign for the unexplained is when the children have bleeding spots on the leg, on the hands, the legs, the face, or whatever. Apart from the eyes being pale, the skin being pale, the hands becoming yellow, they also have bleeding. They can bleed through their nose, they can bleed through their ears, eyes, wherever. So bleeding is a very important sign. Just to make it come home to you, this bleeding can occur inside the body. So you won't know about it because it is not, you can't see it. But the child will then produce all these symptoms that I'm telling you, and you still can't find the reason, and they start giving you iron preparations, and these are not working. So they must actually do investigations to find out blood tests and so forth, not only for the anemia, what they think it is, but for other things. There was recently a case where a child who was in matric, she had signs and symptoms, I'm telling you, she was bleeding. She had bleeding from her womb, which we know as a uterus, and they thought it was just an abnormal period or menstrual bleeding. And she continued getting in and out of the hospitals for blood transfusions and iron in between. She died 2 weeks prior to her matric examination. And when she died, they found out that that bleeding in her womb was due to cancer. So do not take it for granted that the child has got period pains or menstrual pains, and that is why the child is anemic and so forth. So you see, even in a big hospital, they did not look for the cause. So whenever something is happening to anybody, whether you're a parent, a child giver, a carer, or so forth, you make sure you ask why. Why is this happening to my child? Okay? And then you have to insist that they do the investigations. Once you've gone to one clinic twice or thrice and they're not helping, or one doctor, you will ask for a referral to the main centers where you can say, this is what I have done, keep a history record of what you have done, and tell them that this is what is happening. So they won't go from the beginning and delay the process. Okay? That's very, very important. The next one is aching. Children have, aches and pains, they call it growing pains. Now, growing pains go away, but in actual fact, children shouldn't be having aches and pains, headaches, shoulder pains, knee pains, leg pains, whatever pains. They don't have it in the back and so forth. When they start having pain, you need to find out why this is happening, because this could be cancer. Now, with aching bones, what happens is the bone marrow. I think everybody knows what is bone marrow. They've seen it in the soup bones. Now, that bone marrow is the house or the manufacturing center of all the blood cells in our body, the platelets, the red blood cells, the white blood cells. But sometimes one type of cell rapidly multiplies. In other words, it starts to grow in numbers and in size. So that bone marrow canal is too small and it has to start expanding. In doing so, the other cells get overcrowded and they cannot grow. That is why your child is showing these signs and symptoms. So when this bone marrow becomes thicker and thicker with the abnormal cell, the bone starts to move to the bone, actual bone itself. It's soft in children, it starts to move outwards like an elastic band, it starts to stretch. When it stretches, that's when you get the pain. And that bone then becomes very weak, and the child with a slight bump will break the leg or hand or whatever, have a fracture. Now, this is important because children's bones should not break. They bend. I think you've seen it when the bones just bend, and then you just splint it and they come right. That's what we know as green stick fracture. But when the bone breaks, we must ask ourselves, why is this child's bone breaking? It is not hard enough to break or crack. So these aches and pains that are coming in the bone is due to that pressure of the bone marrow expanding. So take note of that. It can be the joints, the child, when I say patient, I mean the child could be limping and walking. And then we tell the child, right now, what's wrong? Why are you walking? And the child, it gets afraid of whatever and doesn't say that there's a pain there. Okay? So please take note, they are your children. They are your responsibility to observe and to ask them and to check. Okay? The important thing I forgot to tell you about in the lumps was the lumps are usually in this area. Okay? And they start being treated for sore throats and things. And there was a 10-year-old child in one of the schools that I went to who was being treated for a sore throat by the doctor. And when the school counselor looked at his neck, because he was not concentrating, he was sent to the counselor to find out what's wrong. She asked the parent, they said, no, he's got a sore throat, so we are now treating him, he gets antibiotics and so forth. So she called the child and said, let me look at your neck. When she opened the child's neck and saw it, there were many lumps. And I don't know how the doctor didn't see those lumps, but there were many lumps there. So then she sent the child for investigation, and they found out that the child had a brain tumor. And that is the reason that this child was sick all the time. Unfortunately, the child was in a very late stage, that the child is now having what we call palliative care. In other words, he cannot be cured. Okay? I'm not telling you these things to frighten you. I'm telling you these things so that you will take note. Okay? Look at your child's neck. Don't just treat the child for symptoms of, infection. It is so important that we actually do this. Okay? So please take care of looking at your child, even if they are 17 years old or 20 years old and they're complaining of these things, because it can be growing inside, but we didn't discover it. Okay? Then the N is for neurological. That deals with the brain, the spinal cord, and the nerves. Now, brain tumors today are very, very common. Okay? They are inside the brain, and when the child goes to the doctor or to the clinic and they see the child's head is enlarging, much larger than the normal, they should investigate it. They should even just send for a normal X-ray and a blood test, which are the cheapest form of investigation. When this tumor is growing in the brain, it depends on which part of the brain it is pressing onto. If it is pressing on the speech center, they will have slurred speech. If it's on the balance center, they won't walk, they walk like drunken people. They talk like drunken people. Or if it is behind the eye will be bulging, you see? And the head gets larger because it must accommodate this extra lump in the brain, in the head, because the child's head is soft and it is still going to be able to get bigger and stronger. But also these little openings at the top here and in the top of the head and in the front here. These openings don't close because the lump is blocking it. So these are the things that we have to take note of to make sure. In my experience, from what I've heard and seen, is children, usually they start from about 2 years old, they will start walking differently. When I say differently, not the normal. They will not be balancing properly, they'll walk with the pain, they'll walk with a limp and so forth. Then you start thinking why. Do not think that it could be just cancer or anything, just try to find out why they are doing this. But it could be possibly brain tumor. Most of the cases that I have heard of and have seen, it is usually they're starting with the leg because that's when you find that the child is wobbling, you see? And that is normally brain cancer. I'm not saying all children will have it, but I'm saying try and find out why this is happening. They complain of headaches. They'll have slurred speech. They will be walking abnormally. They don't have balance. They'll be stumbling. And then we tell them, why are you so clumsy? You see? Then sometimes they will vomit. And the vomit will come out like it will shoot out. Okay? And this is usually happening with brain tumor. It's very important to make sure that you do that. And also the child won't progress. They in school, they won't be able to concentrate. If they are in school, they will have headaches and they do not want to do anything. All they want to do is lie and sleep. So what we need to do is to find out why is this child, from the word go, in other words, from the time the child is born, right until the child is with you, you have to check these things because there is no age limit as such when they can see. Sometimes, recently I was told that there was an 18-year-old girl who had her cancer in the bone was only discovered when she was 18. But fortunately, she was treated adequately and she is now cured. So you see, it's not that it is going to be, uncurable. It depends, or incurable. It's going to be depending on what can be done, how far it has spread. Because cancer from the localized eye or somewhere can break away and spread into the other parts of the body. And I think everybody has heard of cancer, and because you get it in the adults and it's very, very common. So cancer is actually fast-growing abnormal cells in the body. Usually in the adults there may be a cause like smoking and things like that, or working with asbestos or in limestones or whatever. But in children there is no known cause of cancer. The child hasn't been exposed to these things, and the cancer is usually due to an abnormality in the cell itself. In the nucleus of that cell, in the heart of that cell, something went wrong, giving that cell the power to grow very, very fast and to make it abnormal. And that is what we call cancer. If you need any information, you must always contact CHOP. Now, what does CHOP do? CHOP is the Childhood Cancer Foundation. They have been 45 years in existence. In South Africa, they've been for 23 years, and their aim is to reduce, as I said, childhood cancer deaths, and to make sure the children get referred and treated. They provide accommodation for children who are diagnosed and receiving treatment on an outpatient basis, and they live about 50 kilometers away, so they have a house, and all CHOP's resources and services are free, so you do not pay for it. So they'll get the person from their home to the CHOP house, which they call themselves, and then they will take the child from there for treatment and so forth, and once the child is stabilized, then the child will be taken back home. And in between, they will support the child. Newly diagnosed children get care bags, and there's foodstuffs and things that the children need, and the family needs toys, whatever they have at that stage. And because CHOP is a voluntary organization, a non-government organization, they work on donations, and they get a lot of donations in money, in foodstuffs, in toiletries, in whatever is needed for us to lead a normal life. And these CHOP houses, as I was telling you about, that offer the accommodation, they are a home away from home. You come there and they look after you wholly. Okay? So that is very important, because some people don't have the financial means, so they won't take the child for treatment. We need to know that. Then they also provide transport for referrals. If you find that your child has got a referral to the clinics or wherever for doctors, or from the doctors or the clinics to the referral centers, and they don't have the money to take the child in terms of transport to the referral centers, please tell them they must contact CHOP, because CHOP will get to the social workers and they will provide this transport finance for the child. There was a child that was detected by a CHOP person, CHOP volunteer and so forth, and this child was referred to a Tigerberg hospital, and the child's mother did not take the child to the hospital on the appointed date. So it's also important that when you get the funds, you take the child, okay, to that investigation appointment. But the mother, when they found out 3 months later, the child had died. So the reason the mother didn't take the child there was she didn't have funds for transport, but she didn't tell anybody. So please, it is important for us as nurses to ask them that, when we give them their appointment, it is for the doctors to ask them and then to refer them. So that is what we need to do. So they provide transport, they have volunteers in the hospitals and around, they will give you support for the parents. There's social support, that's the social services, they have psychological support, parenting groups. All these are there to make this journey a little bit bearable for people who are suffering mentally, physically, and so forth with their children, and the children are suffering, and all these facilities are available. So it's important, if people can donate, they can donate to CHOP, whether it is clothes or whatever that they have that is extra, or money, because this is always needed, because there are many families that need help, and the numbers are growing. Okay, so the 3 CHOP houses which I didn't mention, there's one is in St. Brand Park, which is our head office. The other one is at Tigerberg Hospital, and the third one is at Plumstead, which is the largest house. Okay. I think I've covered most of the things, but I just want to show you some pictures, and should I remember anything else, because I don't have my slides here, then I will let you know. Okay, that is what the lumps look like. There's the other version of the lumps in the neck. God, we did something wrong and so forth. That is not so. Okay? Please take your children. Thank you so much.
Oh, it's at 2 o'clock, but it's not 2 o'clock yet.
I know. I don't know why. Thank you, everybody, for listening, and I'm sure you're going to take note. Thank you.
Thank you very much, Ms. Matura from CHOC. If you'd like more information about CHOC and like to be clear or more clarity on anything that was mentioned right now, why don't you hit them up on choc.org.za. I see they're also on social media. They're all over social media. TikTok, Facebook, X, YouTube, everywhere. choc.org.za. Now, next online is something that really interests me a lot. And the reason is that I'm a bit of a fundi for tech and when it comes to science stuff. So, did you know that like every 72 hours, somebody in South Africa is diagnosed with blood cancer? And often a stem cell transplant from a matching donor is the only hope of cure that they have. Now, I've got a pamphlet here from DKMS before we call them out here to come and have a chat with us. And on this pamphlet, it says that it destroys blood cancer, and I'm quite keen to hear how that happens. Please put your hands together for a talk by DKMS about stem cell donations. Also, while we're waiting on the gentleman to come to the front, can I ask that all the speakers, when you do your presentation, stay as close to the microphone as you can, because there are people in the back of the hall who can't always hear you if you're too far from the microphone, because you'll just sound a lot softer. Thank you. Here's a gentleman again. I didn't get his name, from DKMS Africa. Bongi. Welcome, Bongi.
Good day, everyone. Thank you for this opportunity, sir. Just to briefly introduce myself, my name is Bongi. I'm a donor regional manager, the donor recruitment with DKMS Africa. So just to explain who we are a non-profit organization that is dedicated to a fight against blood cancer, such as leukemia, anemia, thalassemia, sickle cell, you name them. There's about over 70 types of blood cancer and blood disorders. Every 72 minutes in South Africa, someone is diagnosed with blood cancer. It's very sad. So as an organization, we are embedded with a lot of patients and a lot of families coming through to us for help. So we are trying to help all these patients find matching donors. When someone is diagnosed with blood cancer, many of them, they need stem cells from a matching donor. So as an organization, it's our duty to find a matching donor for those kind of patients. So what we actually do is we appeal to South Africans to actually register as stem cell donors. So we go around educating the public about blood cancer, creating awareness about it, and also recruiting people as stem cell donors. The registration to become a stem cell donor is very simple. You only complete a one-pager form and then you do a 3-minute cheek swab. There's no blood drawing, just a cheek swab. That's the registration process to be a lifesaver in waiting. We're hoping that someday you match someone and you give that patient a second chance at life. You stay on the registry, you might be that match we're looking for. Or you might be a match in 10 years' time, we just don't know, because looking for a matching donor, it's not very easy. We're not looking for a blood type, we're looking for a genetic twin. It's often very difficult. So what we first do in that process, we start in their families. We test their siblings. We don't even look at mother and father because it's given. Each patient match the mother 50% and the father 50%. Therefore, we don't need a 50%, we need 100% genetic twin. We start with the siblings. We found that only few patients match within their families. The rest relies on the public, which is completely from the stranger out there. So as an organization, we recruit people from the age of 17 and 55, healthy people and committed to people who are willing to help these patients. Okay? So our criteria is very simple. It's not that strict. We only exclude people who has serious conditions like diabetes, arthritis, because when you donate your stem cells, it's like you're donating a part of your immune system. It's easy to pass the condition to the patient. But with high blood pressure, which is very common, you can still be a donor with us. Because some people think when they have a high blood pressure, they can't donate, but you can. Okay? So we register from 17 to 55. Okay? The donation of stem cells is actually not bone marrow. We also want to break that perception. That donation is a once-off. It's not a regular donation. You donate only when you're found to be a genetic twin for the patient. If you're not a match, you stay on the system until you are 60, we take you off the registry. If you found to be a match, you proceed. We draw small samples of your blood. We do what we call infectious disease marker to check if you don't have any condition that could put you as the donor at risk or the patient at risk. If you pass that stage, you proceed. We book a physician, a doctor to do physical checkups, x-rays and scans to make sure that you are healthy, you don't have any issues with your heart, because if you have any heart condition, it could simply put you at risk of thrombosis, some form of blood clotting. If you're good with that one as well, a week prior we boost your stem cells so that when you go donate your stem cells, we don't deplete your stem cells, and that we only take the excess amount created by that injection. Okay? And also release these cells from your bone marrow to your bloodstream. That's why we no longer do bone marrow, because the purpose of that injection is to release these cells from your bone marrow to your bloodstream. And then you donate at the private hospital, we cover all the costs as an organization. You don't pay a dime to save someone's life. All we need from you is your commitment to save a life. Because we have been experiencing some issues in South Africa, people are not committed enough for this. So we've been experiencing that. Some donors are falling off the system because they don't want to proceed. Okay? So with that, you could be that potential donor that we're looking for. So you just visit our stand, you make your mark, you register as a stem cell donor. So far on the registry, we have over 100,000 donors on the system, which is like a drop in the ocean compared to the population of South Africa. So we are losing some patients because we cannot find matching donors on the system. Some of them, they are underrepresented because their ethnic group is not represented enough in the system. What do I mean by that? I mean that each patient is most likely to match within their own ethnic group. If you don't have enough people from that ethnic group, it poses a huge problem, meaning that they won't be able to find a matching donor and get to transplant. So we encourage you to come through and to our stand and register as a stem cell donor. Only register once and be a lifesaver in waiting. Thank you.
Thank you very much. Stem cell donation. I'm looking out. Have I got a twin out there? I hope so, because that twin could save your life one day, your blood twin. I mean, thanks to Bongi from DKMS Africa. They are online as well, dkms.africa.org, if you'd like to know more about them. We are going to take a short break now. It's 1:45 now. Can we be back at 1 o'clock with the next speaker, and that's going to be Ms. Natasha Miller. She's a cancer survivor, so we can all be back here at 1 o'clock when we'll continue with the rest of the speeches. Thank you.
This is Kaylee and I love Escape Online. Hi, I'm Jordan and I'm listening to Escape Online.
Escape Online. I freaking love that. Escape Online.
Hi, I'm Dinka and I love listening to Escape Online.
I'm Anna and I love Escape Online.
Ek is Ryan, ek luister na Escape Online.
This is Kaylee and I love Escape Online. Hi, I'm Jordan and I'm listening to Escape Online.
Escape Online. Ek freaking love that.